Alberta's top doctor not dropping the hammer just yet. While other provinces are adding in new restrictions to hopefully crush the curve, Alberta is not.
What we're doing is we're trying to give Albertans every opportunity to work with us in this voluntary way before we put in place those mandatory measures.
Another 323 COVID-19 cases reported over the last 24 hours, bringing us close to thresholds set out in the relaunch strategy.
116 people are in hospital. Last week I mentioned the trend in higher hospitalization numbers is something that we are watching closely. We are currently at a compounded daily COVID hospitalization rise of 3.1% across the province in the past 2 weeks, which is getting closer to the 5% trigger threshold.
With rising cases and 8% of our province's schools on alert, the province is changing who can be tested to help reduce the wait time put on school staff, parents, and students.
Effective immediately, we will be pressing pause on all asymptomatic testing in those who have no known exposure. This is an important and necessary step that will help us reduce testing wait times, get results to Albertans, and limit the spread.
Right now, there are over 3,200 active cases in the province, over 1,600 in Edmonton, over 1,000 in Calgary. One new death has been reported for a total of 293. There are 116 people in hospital, 16 in the ICU. And as snow covers the ground and people head inside socially, Hinshaw wants us to learn from recent super spreader social events where perhaps not all guidelines were followed.
Common element does seem to be that people were indoors together in a social context, and unfortunately enough of those layers slipped enough that widespread transmission happened.